Could you share a little bit about who you are and what you do, and sort of the kind of COVID work that the department has been engaged in for some time?
My name is Leah Roberts, and I work for Dakota County Public Health. I work in the unit that does emergency preparedness and community engagement. And what that means is really we've been very involved in the COVID-19 response from vaccinations, especially right now. But we also did calls to people who were sick in the beginning, help people get things they needed if they were in isolation at home and needed food or things like that, as well as just been tracking the whole response and the way COVID cases have evolved over time.
Should we be still concerned about COVID? Is it still spreading?
Yes, it is, unfortunately. Although vaccines and boosters have done a lot to protect our communities, and in Minnesota, almost 4 million people have gotten the vaccine, which is great news. And in our county in Dakota, we have about 9 out of 10 kids aged 12 and older that have gotten the vaccine. So it's really good news. But we're still seeing a lot of people get sick and even die from COVID, especially for those who are not yet vaccinated. However, it is still here, and it is the third leading cause of death in the United States.
We know that vaccines protect children and families, but we also know there are still some children who are not vaccinated. And this is the time of the year where kids are going back to schools. What should we tell parents who have children who are not vaccinated? Should they be coming to school wearing masks?
First of all, masks are not mandatory in schools, but some kids should consider wearing them. Kids with higher chances of getting sick with COVID, for example, like those with asthma, cancer, heart conditions, should consider wearing a mask. We would recommend that anyone check with their doctor or local pharmacy if they think their child might be at higher risk, in order to kind of decide whether or not a mask is the best option for them. If they can, making sure they're up to date on their vaccinations.
Could you talk a little bit about the types of masks that are available right now?
So we know that hospital and surgical masks are really good at protecting people from COVID. Cloth masks aren't as good at protecting you, but that can be worn if you don't have access to a surgical or an N95 mask. Many stores and businesses still have free masks when you walk in, and those are the surgical or hospital masks. If you're at higher risk of getting sick, if you have a condition that might put you at higher risk, it's important to just wear any mask that you have.
Are there any efforts happening right now where families could still get vaccinations for their kids?
Absolutely. So anybody over the age of 6 months can get a COVID vaccine. Scientists have created an updated vaccine that protects against multiple variants, including Omicron, and that's now available. Those are available at local pharmacies, the doctor's office, as well as at Dakota County Public Health clinics. And so that's something that we recommend everyone look into if they're eligible. Everyone should get a COVID-19 booster. Kids age 5 and older should get their updated booster 2 months after their last COVID shot. There's not a booster yet for the 6 months through 4 years, but there is vaccine available for them. Knowing your own risk and the risk of your family is really important, and trying to keep up to date on all the information. Getting that booster, getting up to date on vaccines is definitely a great idea to protect yourself and your family. If you have questions about COVID-19, you can call your local pharmacy, your doctor's office. Also at Dakota County Public Health, we are happy to answer any questions you have. Our phone number is 651-554-6100.
Someone is sick. Is there anything they can do if they suspect that they have COVID?
Luckily, there are a lot more testing options now than there were previously. So we have very good at-home, over-the-counter tests that families can access. Through the state of Minnesota right now, families can get up to 12 tests, and that's on the state website. Any family in Minnesota can order them to be shipped to their home. There's also, commercially available ones at our local pharmacies. There are still testing sites open across the state, and you can look those up on the state website, as well as at your local clinic or point of care for health. You can get testing there as well.